So how are you today, Mike?
Oh, doing all right, I suppose.
All right. So you've come to the rescue mission, and you're seeking help for your alcohol abuse, I understand, from looking at your application?
Yes, sir.
Okay. How many years have you been using alcohol?
Pretty much all my life.
Mhm.
I'm 35, and since about 15, I can
Right,
remember
right.
getting drunk with my
What,
brother.
Oh, I'm sorry. What, was there some early trauma in your life, dysfunctional home or anything like that? What do you think led you to start to drink at such a young age?
It was just something my brother did, and I did it, and every single time I did it, I didn't have to worry anymore about my life or anything, and
Okay.
just kind of carried on.
Right. It's it can be a beast.
Yeah.
Yes. Now, I know alcohol is your primary drug. Have you ever used any other substances?
Oh yeah, marijuana and meth once,
Meth.
I think.
Okay,
Yeah, stuff
okay.
like that. So.
Okay. All right. Well, what we're going to do, I'll be your case manager, and again, my name is Tim, and the first thing we're going to do is we're going to do what's called an assessment. Now, I have your application, and I went over it,
Okay.
and some of the things are going to seem very repetitive. Okay.
Okay.
But we want to get a good history and a good look at your life prior to coming to the rescue mission. Okay.
Okay.
And what we're going to do is I'm going to ask you about 21 questions, okay? Answer them as honestly as you possibly can, all right?
Okay.
And what that will do is that will help us build a plan, a treatment plan of your goals and the things that we offer here at the mission that we can put together and hopefully get you on the road to success and have a strong recovery plan, okay?
Right.
Okay, so I'm going to start asking you some questions. And we'll see where we end up, okay? All right, the first question is, do you feel you are a normal drinker? Do you feel like you drink much or less than other people? As much or less than other
I
people?
probably drink a little bit more than other
A
people
little
do.
bit more?
Yeah.
Okay. Have you ever awakened in the morning after some drinking the night before and found that you would not remember part of the evening?
Yeah, there's been multiple times when I've wondered how in the world I even got to the place that I was.
Right, it's kind of like being in a blackout, right?
Yeah.
Right.
Yeah, exactly.
And that can be a very scary thing, can it?
Yeah.
Yeah.
Like, how did I get here?
Yeah.
So,
Yeah, I can relate to that. I've had a lot of clients that tell me they drove their car home and don't remember.
yeah. Yeah.
Very dangerous, very scary.
Yes.
Okay. Does any near relative or close friend ever worry or complain about your drinking?
Oh yes, my sister does all the time.
Your sister?
So, yes.
So it sounds like that you and your sister might be pretty close.
We are.
Yeah.
Yeah, we're
Okay.
similar in age, and we've always kind of grown up in the same area and
Right.
just kind of hung around.
Right.
So.
So as your recovery progresses, do you think that your sister could be part of your support system? Would she be?
Oh yes,
Would she
very,
be willing?
yes,
Oh, that's good.
absolutely.
It's
Yeah.
very important to have people in our lives, and especially family, that will support you in your recovery.
Yeah.
Okay. All right. Can you stop drinking without difficulty after one or two drinks?
No, once I start to drink, that's pretty much it. I
Right.
just continue to drink.
Yeah,
So
okay.
yeah.
Okay. Very good. Very good. Do you ever feel guilty about your drinking?
Yes.
Yeah.
Yeah. Especially when I, have those blackouts and things like that, and if I've had to call my sister to come get me, I have guilt about that. I know what I'm putting her through.
Can you tell me a little bit about some of those feelings, those guilt feelings you might be having?
It's just kind of a realization when I'm sobering up of how I'm making other people feel and what I'm doing to them in the process, because it's scary. I mean, she doesn't know where I'm at, and she doesn't know what happened, and I can't tell her because I don't remember.
Right.
So, it's
Okay. Very good.
Yeah.
Very good. Have you ever attended any AA or NA meetings or any 12-step meetings at all?
It's been recommended to me, but I've never actually gone to
Okay.
one before.
Part of our programming here is that you will attend 3 meetings a week outside of our facility, And then on Sunday evenings, the men facilitate their own AA meeting, and you'll be attending that. So you'll get your feet good and wet as far as 12-step work.
Okay.
Okay. All right. Have you ever gotten into any physical fights while drinking?
Oh yes.
Yeah.
Yes.
And can you tell me a little bit about that? Are you the instigator usually, or?
Sometimes.
Sometimes.
It just depends. I mean, people are running their mouth and stuff like that, and it usually spills out outside, and
Right.
the owner will kick us out and be like, can't be doing that in here, and then it just one thing leads to another. And,
Right. Let me ask you this: do you feel like you have any anger issues? Is there some rooted resentments or anger down there that might need to be addressed?
yeah, like I'm angry. I'm angry at my dad a lot.
Yeah.
Yeah, just
Yeah.
he wasn't around growing up and,
Right.
and things like that. So, I looked at my older brother, and that's he set the example for me, and things like that. And I know that drinking's not the way I should be going, but I didn't have much of another example. So
Tell me about your older brother. What's your relationship like with him?
it's distant.
Distant?
Yeah, yeah. He was about 6 years older than I was, and
Okay.
he moved out. He's gone. He's out in California, the other side of the world, doing his thing.
Is there any communication? Do you talk to him at all, or is it completely cut off?
When we do talk, it's really strained, and we wind up having an argument, usually over the phone, about something dumb. So.
Now, do you feel like that's got something to do with your drinking, or is that just because you're so distant, or what? How do you feel that came about?
A little bit of both. It's a lot of blame
Okay.
is attached to that, because he doesn't really drink anymore,
Okay.
and here I am still sitting in the place
Gotcha.
that I'm at, and why can't you be better, and why are you drinking all the time, and
Okay.
it's just putting me down all the time. I don't need any of that.
Right.
It's just that's not. I don't appreciate that.
Okay. Okay. All right. Has your drinking ever created problems between you or a new relative or close friend?
Well, yeah.
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 Okay. Do you feel like you've lost a lot of friends because of your drinking?
Yeah, most of the people that I would consider friends anymore, outside of my sister, would just be people at the bar,
Okay.
go there every day, and it's like, there's my friends.
Okay.
So,
Okay. Alrighty. Has any family member or close friend gone to anyone seeking help for you about your drinking that you're aware of? Maybe your sister?
yeah, probably my
Probably.
sister. Yeah.
Okay. Okay. Have you ever lost friends because of your drinking?
Well, yeah,
Yeah.
a lot of people who I associate with, when I can't hold a job, and you make a couple of friends, and all of a sudden they realize,
Right. Right.
kind of what you're about. Sometimes they don't want anything to do with that anymore.
Yeah.
So that
bridges.
hurts.
Yeah. Yeah. How does that make you feel?
It makes me feel bad. It's
Yeah.
just beat down. It's like, well, who are you to judge, and
Right.
all this sort of thing. So
Right.
it makes me angry again, and I
Gotcha.
oftentimes just get angry from it. So.
Okay. All right. Have you ever gotten into trouble at work because of your drinking?
Yeah, I lost a couple jobs because
Yeah.
of my drinking. I'd go in, and the boss would be like, you can't be here when you're smelling like that, and,
Right.
so they asked me to leave.
Do you feel like now that you're sober and you've detoxed, do you feel that looking back on that, do you feel like that they were probably right and you were jeopardizing yourself and others in the workplace?
Yeah, I can see from even a safety standpoint.
Right.
If I had to be up on ladders a lot in my job and stuff like that, and I
Yeah.
could have hurt myself, fallen down, or toppled the ladder over on somebody, or
Absolutely.
drop boxes or whatever. So yeah, so I can understand that.
Okay, great. Okay. Have you ever neglected your obligations, your family, or your work for 2 or more days in a row because of your drinking?
Oh yeah, I'd be gone for a week at a time. Sometimes just out on a bender or whatever, just doing whatever.
Okay.
So,
Do you drink before noon fairly often?
yeah, about 3 or 4 days a week.
Okay. And when you start drinking before noon, do those type of days end up being usually when you're going to blackouts and things like that, or?
Oh yeah, because I'll just, I mean, like I said before, once I start drinking, I don't stop. So you know, if I wake up and I crack open a beer or whatever to help alleviate the hangover from the day before, it just doesn't stop. It'll just keep on going.
The old hair of the dog, right?
Yes. Yes.
Have you ever been told that you have liver problems or cirrhosis?
No, I've never been to a doctor to even find out those type of things because I don't really want to know.
Well, again, while you're here at the mission, that's something that we will get you involved in. We'll get you connected with a healthcare provider. Well, we also have the on-duty nurse downstairs.
Okay.
And I'll get you involved with her, and she can connect you to different facilities and opportunities in the healthcare field. Okay.
Okay.
Have you ever experienced DTs, severe shaking, visual or auditory, hearing hallucinations, anything like that?
Yeah, shaking is quite common with me. I'll just sit there and just almost vibrate. So.
Yeah, I noticed when you were downstairs in detox that you, for a few days there, looked like you were pretty sick.
Yeah, I was. Yeah, absolutely.
Okay. Have you ever gone to anyone for help about your drinking prior to here?
I mean, you know, me and my sister have talks about it and things like that, but it's not until recently that, you know, my eyes were kind of open to the fact that I really had a problem.
So was that fourth DUI that you just had that kind of woke you up?
A little bit, yeah.
Yeah. Okay. Have you ever been hospitalized because of your drinking?
Yeah, absolutely. Yeah, I've been to, you know, the ER, especially, you know, one time I got pulled over and, you know, I don't remember what I blew, but it was enough to make them concerned, and they took me to the ER.
Okay, so it must have been a pretty high number then.
It must have been.
I would assume, yeah. Okay. Has your drinking ever resulted in you being hospitalized in a psych ward?
No.
No. Okay. Have you ever gone to any doctor, social worker, clergyman, or mental health clinic for any help with any emotional problems in which your drinking was a part of?
Yeah, I just didn't really find all that much help through those sources, so I've talked to him a couple times, but...
Okay. All right, and we've got a couple more questions here, and we'll get this wrapped up, buddy. Let's get through the page. Okay. Have you ever been arrested more than once for driving under the influence of alcohol?
Oh, yes, absolutely.
And it was 4 times?
Yes, 4 times.
4 times. Have you ever been arrested even for a few hours because of other behavior while drinking?
Yeah, especially when it comes to like fighting and stuff like that, because you know the owner of the establishment would call the police, and you know he'd be out there, and one guy would take off, and sometimes I'd be too drunk to take off, so that you know they'd arrest me. So.
Right. Okay. Well, I appreciate your honesty. Okay. What's going to happen next is that we will score your mass test, okay, and then you and I will get together and we'll have we'll start researching some of your goals, what the mission has to offer for you, and how these things can come together, and then we'll develop what's called a treatment plan. Okay.
Okay.
All right. Well, I thank you so much for coming in, and I'll see you in a day or so.
All right.
Okay.
Thank you very much.
All right. Have a great day.
You too.